Good afternoon, everyone. Welcome to UAB's virtual town hall. Just some housekeeping notes. We do have closed captioning available. If you are interested in closed captioning, just look for it in your Zoom toolbar. I'm Rosie O'Byrne. I'm with University Relations. Today we will hear from leadership. First, we'll hear from Dr. Watts, our president. Next, we'll hear from our provost, Dr. Pam Benoit. And then we will hear from our Senior Vice President of Medicine and Dean of School of Medicine, Dr. Selwyn Vickers. And then we'll hear from our Vice President of Research, Dr. Chris Brown. Afterwards, we'll open the floor up to questions, Q&A, and if we don't get to your questions, we will compile all of those. Our leadership will respond to those, and we will publish those in the next e-reporter, which will go out next Friday, May 29th. So with that, I will hand it over to our president, Dr. Watts.
Well, thank you, Rosie, and thank you all for joining us this afternoon for this faculty and staff town hall. Before I make further remarks, I want to thank you, each and every one of you, and our entire faculty and staff and leadership teams for the tireless, unselfish, hard work that everybody's been putting in to fight this epidemic, fight this virus, but also to continue to serve and continue to pursue our very important, multifaceted and vital mission. You know, in these days, the dependence of our citizens on UAB is really greater than ever. And I want them to know, I want you to know, and we all know that we're going to be there for them. What we want to update you today about is plans that have been laid to begin a very gradual and thoughtful and safe return to campus for our faculty and staff in selective areas to begin with. We have been gradually increasing our clinical activity in the hospital and in the clinics, a lot with telehealth in the clinics, but we're increasing our visits and we're increasing our procedures and other things in the hospital. At the same time, we've got 60 patients in the hospital today who are COVID positive. 20 of them are on ventilators, and our outstanding healthcare heroes at the front lines are providing world-class care. And we've saved way, 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 way more than we've lost, but we have lost some. This is a serious virus. It hasn't gone away. Number of cases in Alabama are still increasing, much less so in Birmingham and Jefferson County as in other areas across the state because of the very proactive and strong alignment we have between UAB, our city and their leadership, and our county and the leadership, along with our major employers. We're all working together to keep our people safe, but to keep our missions moving forward. On next Tuesday, we will have the first phase of a graduated return of our research teams to their laboratories. We will continue to have many work from home, but we will move from the limited work model alone to a modified work model. I'm gonna have Pam and Selwyn and Chris tell you more about our specific plans, but we are engaging technology and engaging the best in public health measures and medical measures to make sure that our return of our faculty and staff is safe. Our first and foremost desire is for the health and wellness of our employees, our faculty, and your families. Families of those that we take care of in our community and state. And really the work we're doing is having an impact around the country and around the world. Our researchers continue to work extremely hard. We've written a lot of new proposals. We've got a lot of great ideas and new experiments and studies beginning around the COVID epidemic. And we will get through this and we will conquer it, but it won't be a matter of weeks and it won't be a matter of a few months. It's going to be with us for months to come, perhaps more than a year. So we've got to figure out how to manage the virus to the full extent that we can, given our expertise and knowledge. But I want you to know that your safety is first and foremost, but we do need to pursue the vital work that everybody depends on for us to help solve this COVID crisis and develop a vaccine and treatments for this virus. You may have heard that the remdesivir, the medicine that was created in part by our faculty and our viral vaccine center, has been shown to save lives in those who are very ill. We've started a second phase of that remdesivir study and are one of the leading enrollers in those studies across the country and around the world. So our folks continue to work extremely hard. This summer, our undergraduate and graduate populations are coming back in strong numbers. And I just heard from the provost and Lori McMahon, our graduate school dean, that they think that our undergraduates and our graduate student enrollment this summer is going to be even higher than last summer. It's all being done remotely, but as Pam will tell you, we are beginning to make plans for the return of our students to their clinical rotations with a lot of safeguards. But they need that for accreditation. I'll let her tell you the details of that. So I want to say again, thank you for all of your hard work and dedication. And together, we're going to make a tremendous difference for our people and for all of those that we serve. Let me now turn it over to Provost Pam Benoit to update you on our return to campus plans. Pam?
Thank you. It's nice to be with you this afternoon, and I'd like to echo Dr. Watts' thanks. I've never been more proud than now to be at UAB with all the efforts that are going on every front. I want to talk just a little bit about the reentry to campus guidelines and highlight some of the important features there. The first is the one that the president mentioned, which is that we developed a color coding to signify where we were in the process. With red being an emergency, we actually have not been in red. Orange, which is where we are now, a limited business model, and then yellow, a modified business model, and then green, the new normal, probably with some limited public health restrictions. We are in orange now and trying to move to different phases of yellow. And the first phase of the yellow phase begins on May 26th, moves through June 15th. I want to emphasize that this is a window. Not everyone will begin on May 26th, but there will be different activities throughout that entire time period. And that will include research activities as well as some of the clinics like in dentistry and optometry. Then there's a second phase, June 1 to June 30th. And here's where we're trying to figure out how to put clinical students back into their experiences, and some critical administrative staff may return. The phases that follow, phases 3, 4, and 5, all have, again, another window of opportunity. And as the president said, those windows will probably need to be adjusted as the situation evolves and we continue to gather more information. So one of the things that we've done is set up an idea that we would ask each of the supervisors to develop an operational plan about when their various employees would come back. As the president said, many will continue to work remotely for quite some time yet. We know that this is something that's likely to last between 12 and 18 months. And so again, we'll need to watch the situation as it evolves. So as your supervisor notifies us of who will be coming back in various phases, you'll get an email that will prompt you to complete the web-based training and the UAB health check. Following that, there will be random tests and contact tracing to try to keep all of our community safe. I also want to remind you about the personal hygiene practices, wearing face masks, washing your hands, social distancing, enhanced cleaning. All of those are part of this plan as well. For a very short, nice way of going through what's necessary to re-enter, check out the checklist that's part of this document. There's one for employees, faculty, staff, and students. There's one for supervisors to help you work on re-entering back into the workforce. And with that, I'll turn it over to Selwyn. Dr. Vickers?
Thank you, Pam. And I echo both what Pam and Ray have said, that in so many phases, we're proud of how our community has created not only a value for our city, our county, and our state, and also for the nation, both just how we've led, both clinically and academically. So I'm terribly appreciative to be a part of the community. Pam emphasized the fact that one of the tools that we want to make sure that we do provide to enhance our opportunity to keep a safe community are based on some really best guidelines related to public health and medical knowledge that we have today about the virus. Starting first with hand hygiene, she mentioned, is truly important. Hand sanitizer is one way, but washing your hands is probably even better in a sink that's in your lab or outside the lab, but if not, using the hand hygiene as a secondary choice. We will ask people to wear masks. We understand that you may be feeling fine and it may be cumbersome, but the mask does two things. We know that there are a significant number of people who carry the virus and have no symptoms, and the mask prevents the spread. Secondly, because the spread usually comes from around your nasal and oral, your mouth, the mask keeps you from putting your hands on your face as well. So that will be an important tool for people to have, and we're helping provide that for multiple of our constituents who are coming back. The Safe Together Now platform that Pam mentioned is a design really grown out of the heart of UAB and its informatics community. Sue Feldman, Mohan Thermulai, and Sarah Parkak are the founders of this, and we couldn't be more proud of the work that they've done. But there have been a ton of people, from HR to legal to communications to public health to the School of Medicine, who've all come together to make this a possibility. And as you highlighted it, the training module for getting educated around this is important. It's equally important to understand why and what needs to be done. When you get that, that's a signal that you are in a group that has an opportunity to begin coming back if your operational plan has been approved. Then you'll get the opportunity to fill out the tracker, and reminding everybody that nearly 89 to 92% of all people who develop COVID have symptoms. So it is a very good way to get an early understanding in a building, on a floor, in a community, in a school, where there might be an outbreak beginning and where that might be a group of people who have positive tests and who've been exposed. We believe that that ability of the tracker, if you would, the health check, I would probably best said, will give us really relevant information to our student and our employee health, as well as to our leadership group to make decisions to help protect our community. Pam also mentioned the term tracer, and we've been one of the leaders in the country, actually one of the first 3 states that Apple and Google have worked with to provide a technology-based opportunity to notify people who have been in contact in an anonymous way of those individuals who've been in contact with a positive person who's had a positive test. And Apple and Google are truly committed to keeping this information private. They've gone to court multiple times to protect their cell phone information. And in this scenario, you simply know the date, not the location nor the person who in fact you encountered. It will let you know that time period within a 2-week period if that's occurred. So that being developed with the Alabama Department of Public Health will be a huge advent for us to keep a safe community. Ray mentioned that on the health side, our faculty and our employees have been back for some time, and we have still 50 to 60 patients in the hospital. We'll continually have that. We'll take overflow from Montgomery and Montgomery, Butler County are all examples. Virus and its peak of increasing infections is not over yet. Montgomery made national news because they're running out of ICU beds. We need to do as much as possible. The final component of that Pam shared is that we're going to offer Sentinel testing to give us the best estimate in our community coming back. What's the prevalence of the virus in our population of UAB citizens? So we're doing all I think we can. And I think, as Ray mentioned, we're doing more, if not the most in the nation, we believe, to make UAB a special and safe place for people to return. Hospital will continually ramp up, and we'll do probably near 300 procedures in the next 2 or 3 days. There's well over 250 being done today, and that's a very good sign. Where many places are having a hard time returning, at least our hospital is approaching just north of 80% occupancy, and the procedures are growing as well. So with that, I will stop, but I thank everybody who's participated in helping us begin this return. I would emphasize that what Pam has said, this is a window. The 26th through the 15th, a window for phase 1. So life doesn't flip the switch on the 26th. People stage and grab during that window on phase 1, all the approvals to do so in our research community. Chris?
Thanks, Selwyn. I appreciate the opportunity to share with you all. And I want to thank everybody out there and everybody that's not even listening for the patience with us as we're developing this. The people that we work with, this is a fluid situation and we are doing our best to stay on top of it. I also appreciate the persistence, and that is the pressure that people put to making us remember all the time that what we do is very important. And we want to be safe, but we want to get back to work. A key thing, so as the provost mentioned, we're going to move into yellow phase 1, which allows for the first wave of the resumption of research. That's one of the things that we're getting started on. Before any of that can happen, investigators, principal investigators, leaders of labs must develop an operational plan that allows them to describe how they're going to keep their people safe and continue to do their work. That has to be approved at the departmental level and at the school or college level as well. These are key. This is a key thing. And just because we're starting on May 26th doesn't mean everybody has to show up. Please don't. As your operational plans get approved, you can come back, but we want to spread that out. We want to continue to practice physical distancing. Let's remember that if you can't remember all the details, let's stay safe. How do we do that? We do that with masks. We do that with hand hygiene. We do that with physical distancing, and we do it with the UAB health check, which is the symptom checker that's already been described. If you keep that in mind and then always overlay that on what you're doing, we're going to be okay. One thing, you'll keep up with your training, you'll keep up with the health check, but where this needs to live, the desire to do things safely and correctly and keep up with the health check, symptom checker, it's got to be from inside. Why? We're all in this together. If somebody gets sick and they're not practicing their careful hygiene, others may get sick. The lab could begin to be less productive. It could end up shutting down that lab. I don't mean to be alarmist, but we're moving from code orange to code yellow. And this is a great thing. It's because of the great work we've done so far and the vigilance that we've all had. But remember, we could move back to code orange. And we do not want that to happen. We don't want to go backwards in what we're trying to do in terms of resuming research and resuming all of our return to activities. So let me end my comments by saying there's a lot of details on the uab.edu/reentry site. And if you want to know about research, just look on the left-hand side and go to the bottom. It says resumption of research. Lots of information on there on how you can develop an operational plan and things to consider as you do that, and other considerations about disinfection and things such as that. So I'll stop there, and I believe I'm turning it back over to Rosie to channel our questions.
Yeah, so now we'll open up our Q&A. So I'll ask the first question here. Ashley Ivy is asking, how soon should we expect our managers to complete their anticipated timeline for the return of their teams to campus, and so that we know which phases we are included in? Maybe.
So I'll start that one. Others can join in. Right now, supervisors are working on those plans, and they will try to get them developed as quickly as possible. But I want to emphasize that those plans also have to be flexible. So it's quite possible that a plan that gets developed next week or the following week will need to be adjusted over the course of the summer or the fall as different events happen and we learn more about the spread of the disease. So people are working on those currently, and I'm sure that they'll try to get that information out and available as soon as possible. I know in my unit, we've started working on that this week.
Okay. We have somebody asking that if an employee works in a private office, can they work without a mask and simply wear a mask when leaving their office?
So that's covered in the reentry documents. Dr. Vickers, you might want to comment on as well. The recommendation that we've given is that if you're in a private office and no one else is coming in and out of that office, you do not have to wear the mask while you're in that office. But I would also say when you're in common areas, when you're coming into the building, all of those are times when you should in fact have the mask on.
Pam, ditto. Yes, if you're in a private office, you don't have to wear the mask, but be keenly aware that as you step out into a public space, particularly in a building, we would ask you to wear it.
Tina Reuter is asking, are there discussions or plans to start the fall semester early to end it before Thanksgiving, similar to what other universities decided?
So there are now 15 different scenarios that are out there about ways in which universities might start. One of the difficulties with starting early is that we have to get ready early, and if there are increases during that time, that seems like it might not be a good option. We're looking at the Thanksgiving option and different ways in which we might accommodate that. I know there was another question that said that we would move back a week and that we had talked about that at Faculty Senate. That wasn't a decision at that point in time. It was one of the models that was being considered. So we're still in the process of working on that. Dean McMahon is the chair of the subcommittee working on that. Would you like to add something to that description?
Hi, thanks. I'm glad all of you have tuned in today. So we are talking about many different kinds of scenarios about when to start. We are watching what other institutions are doing, and we're trying to apply those to our institution and what will work best for us. We are really working hard and hoping to come to some conclusions soon, and you will all be made aware of that as soon as the provost makes decisions and others.
Let me add that while there are a lot of different scenarios, there's almost very little data, if any, to validate those scenarios. The biggest concern about Thanksgiving is not about a potential resurgence of the virus. It's more about all of our students and employees going home, particularly the students, and then coming back. And that's something that we're going to have to work around and work through. But we will be making decisions and plans, and we will have alternative plans because it's going to be a fluid situation. And I reiterate to you right now, the virus has not gone away. Cases in Alabama are still going up. Over the last week or so, a 19 or 20% increase in the state. So we will come up with the best plan, with the best safeguards, and the best testing capacity that we can, but that's going to evolve over the coming weeks.
Can I also add that some people have asked me, what does this mean in terms of planning my classes for the fall? And what I can say at this point is that you should plan to enrich your Canvas websites so that you can offer your classes both online as well as in a face-to-face person kind of situation. That we need to have the most possible flexibility going into the fall semester. So if you're beginning to plan now, think about how you can offer your materials in an online remote kind of format.
Right, the next question is, how are units going to get access to mask, hand sanitizer, and surface cleaning materials necessary for enhanced cleaning and hygiene? Purchasing outside the hospital has been difficult and it's been a drain on our budgets. Alan?
Yes, great question. We are trying to centralize all of the purchasing, so we ask that you work with Ron Collins' group in procurement to acquire the materials. The underlying message behind the question, I think, is supply chains are tight for certain things. We know that, so the sooner your units can develop their plans and turn in the requested PPE or sanitizing materials to purchasing, the sooner we can queue that up for you to get your materials in a timely way. We do have a decent supply of masks and gloves for a gradual reentry right now. We sort of have a pinch point with some of the sanitizing wipes, but we're getting some access to those, and there will be alternative methods for cleaning that will be pushed out and recommended by our great facilities crew.
Great. Next question. Do you see the possibility for potential permanent work from home option for some teams, minimizing the amount of workers on campus to free up space to promote social distancing in the workplace?
I'll go ahead and start with that one as well. I think as we go through these phases, that's certainly something that would help us to maintain social distancing. I don't know that I would call it permanent work from home, but probably extended work from home as we go through certain of these phases. We're also looking at what's worked and what hasn't in this environment. There are going to be things, as painful as this pandemic has been for a lot of us, there are going to be things we learn that we will want to apply to the new normal, whatever that looks like. So we'll be examining how productive and efficient we've been able to be in a remote setting, and that's going to be variable across units.
Okay. Catherine Kaiser asked, given that there are many UAB families where both parents work at home, perhaps in high exposure areas, or maybe one, how can we help UAB employees with children find suitable and reliable childcare in small settings to minimize risk for all concerned? The COVID-19 related syndrome in children is scary and may severely impair UAB employees' ability to comply with the return to work plan for their unit out of concern for their children. Is there any plan to help families form small cooperatives to support childcare or on near campus that can go above and beyond state regulations for daycare centers?
This might be a good question for Emily to take. I know she's been working on that issue.
Sure. So we have convened a task force that has been looking at exactly that issue. There are two different items that might be helpful to answer this question. One is that we have developed some guidance that will be pushed out. There's two different sets of guidance. One for working parents that basically gives them advice about what resources are available and how to connect and talk to their supervisor about the options available for them. The second document is guidance for supervisors who are managing employees who have childcare responsibilities. And that lays out sort of resources that are available in terms of childcare, as well as different options for flexibility and flexible work arrangements. And so we'll be pushing that out. The second piece, which might be more relevant to that particular question, is that we've developed a website that's going to be living on HR. It's actually launched today, I think. Alicia's nodding. That has a couple different sections, one of which is currently open childcare centers that are both in-home centers and larger care settings for birth to 5, as well as summer programs that are available for children that are school age that are open and operating in person this summer. And the third piece is virtual programs that are available, many of them through UAB, that can be a resource to working parents. And so we're hopeful that that will start to answer some of the questions around how to balance childcare responsibilities and the return to work. And Rosie, I'll send that link to you so that you can maybe shoot it out to the group.
Carly's asking, do you plan on furloughed employees coming back sooner than the July 31st date? Get that to Alan.
Sure. I think the July 31st date is still the overall date. There will be segments of the furloughed population that may come back sooner as return to work plans are developed by units and then get approved as they come through. So I would say that is still the date, but there is a possibility for certain subsets to come back sooner.
Arlene Savage is asking, a classroom with air conditioning could be a horrible place for transmission of the virus. What about the legal consequences of catching a virus from a class and a faculty member dying because they were in a high-risk group? Let me give that to Dr. Vickers.
So couple things. Number one, we are giving our employees the opportunity to work with employee health to identify themselves in that category. In the process of going through the health check, we're not asking you to tell us that, but we recognize that it's certainly a group of our constituents who would have concerns. And we want to make sure we give opportunities to accommodate them in that setting. So we're making sure that they go to employee health. I would say in our medical community, we face that issue, and across the nation we faced it. I think what has occurred is two things. We have tried to actually create platforms that limit the exposure to those individuals that are truly high risk by, first of all, testing all of the admissions and testing all of our procedure patients to know who and where they might have risk of exposure. We're trying to do that same thing, even though we're not testing everybody yet on our campus. It's aspirational, but we're trying to make sure we limit their exposure to areas where individuals will have a high risk of carrying the virus. And then finally, I'll have to say on the healthcare side, in the strategies, in addition to trying to make sure who's positive and who's negative by molecular testing, we've tried to mitigate the exposure by some opportunities of where they might conduct their work and take care of patients. But like most places around the country, we've not been able to remove people completely from the opportunities as well as the responsibilities of doing their job because of their risk in taking care of patients.
And Dr. Vickers, probably for you as well. Steve Ostad asked, Dr. Vickers mentioned the availability.
Rosie, before we get to that question, I know Alicia has some additional information to offer on the last one.
Great.
Great, thank you. On the training that has been developed that everyone will be asked to do as they transition to re-enter back into the to campus, there is a section that asks if there is a need for a level of accommodation, and maybe that's due to an underlying health condition. So, and it routes you to a process so that you can be assessed if there is an accommodation required or needed. So as everyone is re-entering into the workforce or onto campus, we will ask that question and give opportunities for that level of assessment.
Thank you. Steve Ostad asked, Dr. Vickers mentioned the availability of antibody testing in the last town hall. Now he's mentioned Sentinel testing. Where are we in terms of those tests?
So I apologize for not clarifying. And when I'm speaking of Sentinel testing, I'm still referring to the molecular test that's PCR based, based on viral load. The antibody test, as you know, Steve, on serology based on someone responding to an exposure or seroconverting after responding to an exposure to the virus. We have availability, and we believe we have a test that has very good specificity and sensitivity in the range of 95 to 96% or 93% at the lowest. So we think it's good. Even with that test, though, we don't know that the antibodies that it detects mean that you have immunity. It just means you have antibodies. The second thing is we still don't know the complete clarity around the role of the antibody test. And what do I mean by that? We can test you if someone desired or was ordered to see whether you've been exposed and you have antibodies. Again, can't guarantee you that means immunity yet. But more importantly, when you look at large series, particularly in the areas where there is the most prevalence of the virus and the community's been tested, no more than 10 to 12% are seropositive. And then if you look at broad structures, it's 2 to 5%. So the reality is there's not a lot to do with that data. because you got 96 or 95%, or at least 90% of your constituency who doesn't express the antibody, and you still have to have a plan for them. When you get to a 55 to 60%, then you're approaching an opportunity for herd immunity. So what we'd like to be able to do is that in models of taking samples, if not everybody, we'd like to have a baseline measurement of antibody testing to know what with a sample of what the community testing looks like, and then probably a later period in the summer to be able to do so. That's an aspirational goal. We can do probably about 1,000 a day. As we grow that, we like to do that with some population within our community and then retest a population to see how we are approaching a level of exposure that really makes a difference.
Great. The next question is, can UAB make its own decisions about fall scheduling or semester, or will one decision be made for all of U of A campuses? Dr. Benoit?
I actually am going to give that to Dr. Watts.
Well, I think that it just depends on the specific plans on the 3 campuses. Where we can aid the other campuses in planning, because we have the most medical and public health expertise, we want to do so. But each of the 3 campuses are different, and the constituents of the members of those campuses are different. And we will work with the system leadership, the other campus leadership, our board of trustees, to put together the very best plan that meets the needs of UAB. And we want to help our sister campuses in Tuscaloosa and Huntsville be as safe and productive as possible too.
Great. Have any plans been made yet regarding UAB athletics?
I'll take that on. What we're planning right now, in the broadest sense, is as our students return to campus in the fall, our student athletes will return to campus. And depending on the prevalence of the spread of the virus, we will make the best recommendations we can coming into the fall semester. Right now, as we've discussed practices, etc., we don't believe it's safe for our student athletes to have contact sports and be together right now. We don't know enough about it. We don't know how to protect them well enough. So right now, they are not going to be practicing together on campus. Now, they've been practicing together, physical activity and exercises and strengthening and all those things through Zoom video conferences, through work with their trainers, but they're doing it remotely, like we're working remotely and we're having this discussion today remotely. It is our hope and goal to be able to have the return of our athletic programs into competition in the fall. You may have heard that the NCAA made a statement about they're going to allow the return of football and men's and women's basketball this coming academic year. They don't have any data upon which to have that strong an affirmation. And we're going to plan for that ourselves, but we're going to plan first and foremost for the safety and the protection of the lives of our student athletes and the athletics department and so forth. But we're going to be making careful planning, and it's going to be guided by data and medical and public health information and the ability for testing and for how we think we might be able to bring those teams together. Our current date for return of fall classes is August 24th. And usually that would imply that our residential campus students and our student athletes would come back before then. Sometimes the student athletes stay over the course of the summer and take classes, but also exercise and so forth. We're not going to have any group activities until we know that it's safe. So it doesn't matter if the governor and the president said it's okay to go to Gold's Gym, okay? They are not experts. And they don't have any expert basis for saying that beyond they want to see their economy restored. But we certainly want to see the economy restored as well. And we want everybody back to work, and we want to be able to be as productive as possible. But we're going to keep safety and the lives of our employees and their families first and foremost. So we're going to try to do this gradual return in the most data and knowledge informed way possible, using our best expertise. And we're going to have to be flexible and learn and adapt. But I can promise you, I don't think there'll be a campus in the country that's better prepared than ours.
I'm going to compile several questions that are centered around the same topic around the tracker. So how often will people be required to complete the symptom tracker? Is the health check app required for research resumption, and when will it be available? Maybe Chris?
So,
Yeah.
so the health check app is fundamental to gathering information about what activities are going on both at a school, a unit, and an institutional level. The data coming back for that is important to go to employee health, it's important to go to student health, and it's important to go to a group of leaders who will be looking at an incident command team to make sure we can act on data when we see it. So yes, you'll be asked to do that when you have gone through the LMS learning module. The second piece is that the average incubation of the virus, not the symptoms, is about 4 to 5 days. So that's why every 3 days you're asked to respond to a text that you would give. We would ask you daily if you have a symptom or a change in symptoms to respond every day if you have changes. But we will inquire and ask that you document a response every 3 days. But that's not absent if you have some symptom that you shouldn't respond on a daily basis if that occurs, because that will be important for us to act on and you to take action as well.
Let me make a couple of clarifying points as well. This application is very simple. If you are prompted, it will say, how do you feel today? If you're good and well and healthy, you say that and nothing else done. If you say, you know, I'm not feeling well today, I feel sick, then you go into a series of questions that would give information indicative of CDC guidelines for the diagnosis of potential COVID infection, fever, cough, chest pain, etc. And if those are positive, it will then give you the next decision points about either contacting employee health, contacting student health, and what to do, but not to come back to work if you have any symptoms until you're totally checked out and well. And let me make it clear, this isn't optional. This is required. To come back to work on campus, you have to take that new training module, which will teach you about health check. It will teach you about the proper safeguards, social distancing, hand washing, wearing masks. And then when you have those two in place and have returned the communication that you are ready to go back to work, you are cleared. If you have done those things, then you can come back to work. But let me also say about the safety guidelines: mask, hand washing, social distancing, safe practices, extreme hygienic cleaning of surfaces is required. You're going to come to campus and you're going to work. Those are all required. Number one, they're in your best interest, in your safety. Number two, it's in the interest of all the folks working around you and your families even, that you go home to, and the people you may come in contact with in your community. Those masks prevent the spread from the person who has the virus to others. That's why it's not optional. You know, you might say, well, I don't care. I'm going to take my chances, not wear a mask. If I get it, I get it. Well, that's not good enough for us as a health promoting and leading institution. So the bigger part, though, is it's inconsiderate of your colleagues to not wear that mask.
Great. Did anyone else want to follow up on health check? I see a few questions coming in, and because I've been working with the health check team, I might just try to help clarify. Somebody, Mandy Kroll, is asking, will using the health checker on the UAB app be the correct app to use as an employee, since the website says the checker is not the same as Help Beat COVID-19 app? And that is correct. The team that put together Help Beat COVID-19 tailored that product for UAB reentry. And just a reminder to everyone, because we are phasing in, if you do not get a prompt from the LMS to take the training, you do not need to go and do the health check right now until you hear further information. But right now, we're really trying to focus on that research community. So if you don't get that prompt, you don't do health check currently, but health check is the UAB tool. So just trying to answer that question. Someone's asking that the New York Times recently reported that stagnant plumbing systems in empty buildings could put returning employees at risk of Legionnaire's disease and other illnesses. Is UAB considering this in their plans for return? I'm going to give that to Alan, maybe.
Sure. I would say that our maintenance and facilities crew have cleaning and operational guidelines that they're following that are based on CDC's guidance, so the buildings will be safe for return.
There's quite a number of questions that are asking about testing of faculty and staff, and will families be eligible for testing of family and staff? I don't know who wants to take that.
If there is right now, I would say two things. There is significant capacity in the Jefferson County area to get tested. And so that I think that's available for individuals who choose to do so through the multiple test sites. And you can go to the Jefferson County Department of Health website and they'll show you the sites where you can get tested. I think the area where there might be the opportunity, but it would be a part still through the Jefferson County Health Department, is that if a UAB employee became positive and they were worried about their family's exposure, that still would be a mechanism where families would get tested through both contact tracing from the state and the testing opportunities that are now very much open within the region of Jefferson County.
Great. Lori Parsons asks, some universities and colleges have already dispersed CARES Act money to their students. Where is UAB in the process? Dr. Benoit?
Yes, so we have sent emails to students who are eligible for this funding. Within 2 days of those emails going out, we had over 1,000 students who had filled out the application, and we plan to begin the distribution of those funds on June 2nd. So we are into the process.
Someone is asking, can you address which part of the phase research administration, which I think they're asking which phase research administration would fall? Chris?
The yellow phase 1 is for faculty, staff, and grad students and postdocs who need to be back on campus to do their research. Research administration, by and large, is something that can be done remotely. And so we still encourage, no matter what, that if you can do your work remotely, that you continue to do that. If for whatever reason, if your research administration requires you to be on campus and your supervisor and you have an operational plan in place and have done the health check and the training, then you can come back in. But we don't anticipate a lot of research administration in the first phase on campus.
Several follow-up questions on masks, which Dr. Watts explained quite well, but people want to know, is there going to be enforcement? And if so, how would that be enforced to wear masks?
It's going to be the responsibility of the supervisor to be sure that their employees abide by these requirements. If they don't, they may well be sent home. And if you want to work on our campus, it's going to be required that you follow these safety guidelines.
Right. The next question, based on the Medicine Town Hall yesterday, the delineation between what is UAB and what is hospital isn't clear. Do you have suggestions on how to help those of us who straddle entities understand when we follow guidelines from which entity? Dr. Vickers.
I would say, and I'll get Alicia to comment, as well. It's not easy, but Alicia, I'll let you go before I make a statement.
Okay, thank you, Selwyn. I think that the one of the things we've done to help with that, and it's not absolute all the time, but we develop the work groups that define and place all of our staff into either work group A, which is academic and administrative, a work group C, which is clinical. And then our faculty fall into a separate work group, which is work group F. And so because sometimes those lines are blurred, those work groups were defined to try to provide more clarity to help each employee understand where their work group is and which policies and processes that they would follow. And you can find your work group on the website. You go to the HR website and look at employee work group, you can log in and it will tell you which work group you are part of.
Right.
I don't have anything else much to add, but that is what I would say as well.
Okay, I'm going to compile several questions to follow up about sanitizing buildings. People want to know if the entrance of every building would have sanitizer, and could you comment on housekeeping standards? For instance, stairs will be used more, and in the past, stairs were not necessarily cleaned frequently. So, Alan?
Yeah, and is Greg on? Is he in the Zoom room, Greg Parsons?
Don't believe he is. Okay,
well, yeah, I'll be glad to comment. So, yeah, there are new heightened sanitation standards. Though, first of all, it relates to the approved disinfectants that the CDC has approved for the virus. So we've ordered those in quantities, and housekeeping has been trained on those uses. There will be much more frequent wiping down of surfaces that come into contact, such as handles on doors. You're right, stairwells will be used a lot more frequently because we are going to encourage social distancing in elevators. So people, particularly if it's only a couple of flights, we're going to highly encourage the use of stairwells. And yes, they absolutely will be cleaned to a higher standard than pre-COVID.
There's a question. There's a rumor that senior faculty over 70 will not be allowed on campus until September. Is that true?
That's a rumor.
Yeah, no.
Okay. Let's see. Several questions have come in about students moving to dorms. Some will actually move into the dorms, and how will that change? Dr. Benoit or Dr. Jones? Let's see.
Certainly, this is yours, yeah.
I'm sorry.
Go ahead.
Okay. Right now, if you look at the number of students that requested to live in the residence hall, i.e. by making a deposit as well as signing a contract in early spring, the demand to live on campus was much greater than the capacity. And currently, given the last 90 days or so, we still seeing that the demand is greater than the capacity. So we do anticipate students living on moving in and living in the residence halls this fall. Certainly, one of the things that have yet to be decided is the number of students that will be living on campus. We're looking at a couple of models. We're looking at full capacity, we're looking at half capacity, and we're looking at something in between. Certainly working with the campus leadership, working with the chairs of the Transition Task Force, Alan and Pam, certainly a decision would be made in the near future.
Okay. Someone is asking, how far off are we from sharing information about reentry to current and prospective students? I'm concerned they are creating their own narrative about what we are planning to do, and they are making decisions about enrollment without having accurate information. So Jim, and then Dr. Jones, perhaps, and Dr. Benoit, if you want to answer that.
Hi, Jim Bakken. We actually have a draft communication to all students that's routing for approval now. And so I think we will have an update to students early next week.
Anything you want to add, Dr. Jones or Dr. Benoit?
I will say, if you look at other institutions, very few institutions have declared exactly what they're going to do in the fall yet. And so I don't feel like we are behind where other places are at.
Okay.
And just to be a little more specific, most of our dorm rooms, certainly our newest buildings, have 2 students per room in fairly close proximity. And we will have to assess how all of this is evolving. And it could be that we would only allow 1 student in a room. And if there are, larger suites with bedrooms and so forth, there would have to be an adequate plan for safety in order for us to let that occur. But we're monitoring that very closely, and it's a fluid situation. But we expect to have students living in our residence hall this fall, but we just don't know exactly the density and how it's going to be organized. We're going to learn a lot through our research return, and we're going to study that and use those data for further faculty and staff return and for resumption of student activities. We are equipping our instructional classrooms with new equipment that allow us to do video conferencing or in-class teaching at the same time. So we're looking at everything to make it as flexible as possible, but we don't have a crystal ball, and we can't see 3 months from here in absolute clear vision, but we will try to make the very best decisions for the safety of everyone.
We have time for one more question. There are questions in the community about how HIPAA applies to the tracers with Apple, Google. Are those who are tested entered into the tracer if they are signing HIPAA agreement under the guise of research? I think Kurt is on the line, and Dr. Vickers, maybe.
Yeah, this is Kurt. The Tracer application has all of the data associated, encrypted in the operating system itself, and we can only access pieces of that. And as Dr. Vickers discussed, with the tracing application, all we're reporting to the individual is the date that something occurred, a possible risk exposure. We're not capturing other data. We're not sharing other data. We actually can't get to it within the operating system. So the reason why UAB is partnering with the Alabama Department of Public Health and with Apple and Google is because they're putting the greatest protections for your privacy and security into the app.
And I would say that with what Kurt said, so the data of a positive test is going to the State Department of Public Health that verifies that for the tracer. And in the tracker, you have to voluntarily put in that you are tested positive. So it's information that we're not taking that you would have to give permission to have.
I also want to say that if you are notified that you've been in contact, it does not tell you who might have tested positive. That is anonymous. It just says that you have been in contact for more than 15 minutes with somebody and you need to take certain action steps.
With what Pam's saying, that's very true. And the actual capacity of it is pretty smart. It's actually able to look at attenuation, whether you're in contact with somebody through a plexiglass wall or through a regular wall. It's designed to be pretty smart. The time period that you're in, as well as the distance, gives a risk score that we've helped design that I think makes it realistic and relevant. And so when you get it, the response to either go back in and get your document your symptoms or to quarantine or get tested will be relevant. So I think it could be very powerful.
Great. Dr. Watts, any closing remarks?
Well, I hope this has been helpful. We really want to give you as much information as possible and to provide you with the very best safe conditions to return to work when it is appropriate. And I would say, as far as following the face mask and the guidelines and so forth, I cannot believe that every UAB employee is not concerned about the health of all the people around them. So I would say it's the right thing to do. Think of others, and it will be required. So we're thankful of all you're doing, and keep up the great work, and we will continue to try to inform you as well as possible. Pam, any parting comments?
Just to thank you again. There's an enormous amount of effort that's gone into getting us to this point, and I know that we'll continue to work hard together to make sure that we come out the other end even stronger than before. So thank you all for your efforts.
We will compile all unanswered questions and have leadership answer those questions, and they will be in the e-reporter, the next e-reporter, which will be Friday, May 29th. So thank you for joining us today. Bye.
Thanks a lot.
Thank you.